Hello, my dear students. So today we are going to learn in detail about the anterior triangle of the neck. Myself, Dr. Elizabeth Sojan. So here we have in A Dental Formula, we have, if you are familiar to the first, not familiar with the channel, please subscribe to the channel. We are going to, in detail, we are going to study about the anterior triangle. It will be very useful for all the undergraduate students who are in the first year PDS as well as for the NEET MDS entrance exams. Okay. So aspirants. So please let's go directly into the lecture without wasting time. So anterior triangle of the neck. Anterior triangle of the neck, as you can see very clearly in the picture, it is actually lying between the midline of the neck and the sternocleidomastoid muscle. Okay, so the anterior triangle, it's a bigger part. So you can see the midline of the neck portion and you can also see the sternocleidomastoid muscle. So the entire portion in between this is called as anterior triangle, and the one which comes behind is the posterior triangle. So this is the basic level of knowledge which you will all be knowing. Okay, now let's go in detail about anterior triangle. So each and every point is very important for exam, especially the division of the anterior triangle into various sub triangles. Okay, so first of all, let me tell you the boundary of the anterior triangle. So here we have, as you can see in the picture, the boundary, the anterior median part of the neck, okay, which is the central part, the middle part, and you have laterally towards the side. Just now I pointed out that orange line I have drawn through, that is the sternocleidomastoid muscle. Okay, so you have the area. So then on the top part, what you have, the base of the mandible. Okay, so the base of the mandible, and you also have the line joining the angle of mandible to the mastoid region. So that forms the triangle, anterior triangle. Clear? Now coming on to the subdivision. So anterior triangle is basically divided into four sub triangles. Okay, as you can see in the picture, the various four sub triangles. Okay, so let's give a different color to the various sub triangles. Okay, so here you have the first one, the submental triangle. Can you make out the submental triangle? Yeah, that is the half of submental triangle, because half of the submental triangle lies onto the right side and next to the left side. Okay, so this is half of the submental triangle. So one part goes to the right side of your body, another part goes to the left side of the body. The next, uh, let's give a green color to a very important triangle, that is the digastric triangle. Can you make out? Yeah, that is the digastric triangle. Okay, then next, let's give a very important triangle which is coming, that is the carotid triangle. Can you make out? Let me give it red. Carotid triangle. Okay, so this comes the carotid triangle. So we have three triangles now, and the last one we have the muscular triangle. Okay, the muscular triangle. So you have here the muscular triangle. Okay, am I clear now? Yeah, so these are the four triangles which are seen in the anterior triangle. Okay, so everyone must be thorough with this, the exact location of the triangle, because in NEET MDS exam, they give you a label missing image oriented questions where they will just point out one of the triangles and they will ask you to label that particular triangle. Okay, so options they will be giving. So in last previous years questions, there was a question, an image exact similar to this one image was given, and they just pointed out the area of carotid triangle and they asked us options. Okay, options were given. So it is a very simple question. Okay, but only thing is you will get confused when you are in the exam hall. So be thorough with this. You have here the submental triangle. Okay, you have here the digastric triangle, you have here the carotid triangle, and the last one you have here the muscular triangle. So these are the four triangles within the anterior triangle. Okay, now let's move on to the first triangle. So the green one which we have colored now, that is the submental triangle. Okay. Okay. Coming on to the submental triangle. Okay. So this is our submental triangle. So the submental triangle is actually the median triangle. It is in the center, isn't it? So it is called as the median triangle. And on each side, what is present? On each side, there is the anterior belly of the corresponding digastric muscles. Can you see clearly the digastric muscles? Yeah. So I'll just give the color to it. Okay. So this is the digastric muscle. Sorry, 1 second. I've given wrong color to the submental triangle. So this is our submental triangle. And on each side we have the digastric muscles. Okay, so this one is the digastric muscle. Okay, so the anterior belly of the corresponding digastric muscle. So just check out where is the posterior belly. The posterior belly is lying here. Okay, so this one is the posterior belly. Clear? So the one which is giving lining to the submental triangle is actually the anterior belly of the digastric muscle. Very important question. Okay, anterior belly of the digastric muscle. Clear? Yeah. Now coming on to the various contents. Okay, the contents of this particular triangle. So what are the contents of submental? It's very easy to remember. Actually, you have the submental lymph nodes. Okay. So in this particular triangle, okay, you will find submental lymph nodes first. Okay, submental lymph nodes. Then you will find the submental veins. Okay, submental veins which join to form the anterior jugular vein. Clear? So that is an important question. The submental veins join together to form the anterior jugular vein. Okay. Now, where does the submental lymph nodes drain into? That is another important MCQ they ask. The submental lymph nodes. So just now I told you we have mainly the submental lymph nodes and submental veins. Okay. So the submental lymph nodes will they will drain into a particular area. So they drain the superficial. So they drain mainly which parts? The superficial part just below the chin area. Okay, the lower lip. Okay, the lower lip, that to the central part of the lower lip. Okay, the lower lip, the adjoining gum area. Okay, and the anterior part of the floor of the mouth and tip of the tongue. Okay, so if you have any lesions in these areas, it will first drain to which lymph node? Submental lymph node. That is very, very important. Clear? So if you have any lesions in this area, that is in the chin area or in the lower lip area, the central part of the lower lip area, or tip of the tongue, okay, or floor of the mouth, okay, it will drain into the submental lymph nodes. There should not be any confusion in this. It's very important. Clinical application level questions will come from this. So submental lymph nodes drain all these areas. Then submental veins will join to form what? Anterior jugular veins. Okay, anterior jugular veins. So that's the end of submental triangle. That's enough. Okay, so these are the three important MCQs they will ask from submental triangle. Firstly, you should know to locate submental triangle. Secondly, they will ask you which part of digastric muscle forms the boundary of the submental triangle. That is the anterior part. Then thirdly, they ask you which are the contents. You have submental lymph nodes and you have the submental veins. Fourth, they'll ask you which are the areas it drains. It's a clinical application level question they can put from this. Then lastly, where does the submental veins drain into the jaw to form the anterior jugular vein. Okay, so that's it. Okay. So let me stop the lecture here. So tomorrow's class we'll be learning in detail about the digastric triangle. Okay. Yeah. Thank you. If you have any questions regarding this particular topics which I've taken today, please contact, give a comment. I will be replying soon. Or if you have any doubts, you can join our WhatsApp group. Okay. Thank you.